Hi, I'm Dr. Rick Duplantis, and welcome to my show, It's Your Health. I hope that you are remaining steadfast in your New Year's resolution, if it is to improve your health. Continue on your exercise program, and I hope that you're sticking to the dietary changes, lifestyle modifications that you're making to bring about these changes as weight loss and increased fitness and better health. Our topic tonight are medical news briefs released this past week on the Zika virus, new dietary guidelines. We're going to talk about the American College of Physicians' position on generic drugs as well. Interesting topics nonetheless. Okay, and talk about the Zika virus issue, and you really don't have a worry about it unless you are a female and you're pregnant. And the Zika virus is spread by the bite of a mosquito, and it affects the fetus, the developing fetus in these pregnant women, and the infants are born with hydrocephaly, and it can cause death as a result in these infants. And now I'll go to that brief article on the Zika virus. Zika virus is a mosquito-borne infection, as I mentioned. It's believed to be caused in microcephaly in infants born to infected mothers. And it's crossed from Latin America now into Texas. And this has been reported this past week. The case of Zika in a traveler recently returned from El Salvador. It was confirmed through investigation by the Harris County and Texas health officials and the Centers for Disease Control, the CDC. The case is expected to result in a major new surveillance and vector control initiatives. Physician Peter Holtz, MD, Dean of the National School of Tropical Medicine at Baylor College of Medicine at Texas Medical Center, there is a perfect storm brewing for Zika virus in the U.S. It was never worried that Ebola would take off here, but this physician is worried about Zika. We have two species. The Aedes mosquitoes can transmit the Zika in our area. We also have high levels of poverty, resulting in people living without window screens and near discarded tires and other water-catching containers where you have standing waters where these mosquitoes can breed. Now, this physician went on to say that the Zika infection usually produces a nonspecific influenza-like symptom in pregnant women, with the associated birth defects becoming apparent only 9 months later. By that time, it's too late. The first case of Zika infection in Harris County is a wake-up call. It's a warning that we should immediately start implementing programs to activate surveillance. As we move into the spring and summer months, if we start seeing cases among people who have never traveled outside the country, we will need to implement an aggressive mosquito control measure, as well as health advisories for people to implement their personal protection against this mosquito. Such measures would include emptying or covering any container that could hold water, such as standing water in the yards and abandoned houses with swimming pools, tires, buckets, flower pots, bird baths, and repairing leaks or taps on septic tanks. They would also include using screens and having air conditioning if possible. Dr. Holtz noted that people likely to be exposed to mosquitoes should use one of the CDC's recommended insect repellents registered with the U.S. Environmental Protection Agency, such as DEET, olive lemon, eucalyptus, or IR 3535. When they are used with sunscreen, the CDC recommends that the insect repellent be applied after the sunscreen. This physician also said that mosquito repellent should be reapplied every couple of hours, and that people anticipating mosquito exposure should also consider permethrin treatment of their clothing and gear. Dr. Shaw is executive director of the Harris County, Texas Public Health Environmental Agency, told them that the problem in Texas, the patient developed typical symptoms of rash. He had muscle aches, she had joint pain while visiting El Salvador in November 2015, and sought medical care when symptoms persisted after returning to the United States in December of 2015. Screening tests and further laboratory studies resulted in notification from the CDC of the preliminary positive for Zika virus. The agency promptly alerted area physicians about the Zika case. This physician urges that to keep Zika in differential diagnosis for doctors to look out for this, along with dengue and West Nile when considering possible mosquito-borne viruses, especially in patients who have traveled to a country where Zika is present. You know, the common denominator for these diseases is the mosquito. Countries currently known to have Zika infections include those in tropical Africa, Southeast Asia, the Pacific Islands, Central and South America. The first cases of Zika in Puerto Rico was reported in December 2015. Dr. Shaw warned that although there has been no local transmission of Zika as yet in the continental United States, you know, areas along the Gulf Coast have populations of 2 species of the Aedes mosquito that serve as vectors for this Zika virus. This physician also stated that a patient with sufficiently high Zika viral load could, in theory, pass Zika on to one of these mosquitoes if bitten. His advice for travelers is to prevent getting bitten by mosquitoes, and if you do develop symptoms, present yourself promptly for medical care. If you have the symptoms, don't ignore them. Do contact your local medical physicians. Okay, we have our next topic in medical news is the increased use of generic drugs by physicians for patients. You know, in our society, you know, the cost of pharmaceutical agents continue to rise. A lot of these medications, you know, putting these drugs out of reach for patients that really need them. Many generic drugs have come along and the patients have access to these medications because they're more affordable. You know, a lot of patients are in a situation whether to fill the fridge or fill a prescription. And we have many community type health programs here that do help those individuals that need these pharmaceutical agents or have problems paying for them. There's very special programs designed to help them with this medication. Many of the pharmaceutical companies will as well donate or give the medication to those patients, especially the elderly who cannot afford them. Okay, and now we'll go into that article regarding generic drugs by the American College of Physicians. You know, the American College of Physicians Clinical Guidelines Committee has released new best practice advice. It encourages clinicians to prescribe generic medications over brand name drugs. If possible, the committee notes that the cost of brand name drugs is one factor contributing to the lack of adherence. And the underuse of generic drugs is one reason U.S. per capita health spending is higher than any other country, but is not associated with improved outcomes in many areas. The committee's goal was to provide practical advice based on the best available evidence about traditional small molecule pharmaceuticals. That advice includes suggestions for substantial new regulations of clinical prescribed behavior on the part of physicians, clinician interactions with pharmaceutical companies, and the reimbursement policies, as well as the new research initiatives to provide more robust data on safety and efficacy of generic medications. Now, the American College of Physicians analysis addressed 5 questions. How often the brand name drugs are used when generic versions are available? How to use the generics influences adherence? Whether brand names and generics have similar clinical effects? The barrier to increasing the use of generic drugs, and strategies that can be used to promote greater use of generics and better adherence to drug regimens. Authors identified these 5 points. Conclusions based on review of 2,500 potentially relevant citations, which were refined to include only studies that provided original empiric data directly relevant to the key questions. You know, the team excluded studies reporting only pharmacokinetic and pharmacodynamic differences between the drugs, as well as studies of various drugs, the clinical and regulatory complexity and limited evidence for the latter. You know, cost and adherence emerged as a key area of concern in the use of these generics. You know, higher out-of-pocket costs for patients have consistently been associated with lower rates of long-term medication adherence. they cannot afford them. For example, prescriptions for brand name medications are almost twice as likely as those of generic therapies to be abandoned and is never picked up after being used. The generic use of these drugs result in better long-term adherence because the patient can stay on the drugs over a longer period of time. Wayne Riley, president of the American College of Physicians, commented, generic medications are consistent with high-value care. They are equally in quality, are cost-effective, and help patients to take medicines they need to take when prescribed. And if you can't take the medication prescribed to you, you can't address your medical issue. And this has been a problem in medicine for many, many years, the high cost of pharmaceutical agents, and they continue to rise. However, the authors acknowledge that the data on the effect of generic medication on adherence are mixed. A recent study of Medicare patients with diabetes shows that up to 45% of branded drugs taken by Medicare patients with diabetes could be treated with equally effective generic drugs at a much lesser cost. He cited a study that was done. He estimated that the Medicare would save $1.4 billion for patients with diabetes alone if clinicians followed the Veterans Affairs System practice of combining generic substitution and therapeutic interchange, find as a substitution of similarly effective but less expensive chemical entities. The authors noted that the brand name drugs may be clinically appropriate in situations in which neither generic substitution nor therapeutic interchange is possible. The concern about whether generic drugs are as effective as their brand name counterparts has been a recurrent issue in medicine and by the patients. The American College of Physicians report notes that U.S. Food and Drug Administration approval requires that a generic drug demonstrate the equivalence, the bioequivalence defined as the absence of a significant difference in the availability of the active ingredient at the site of drug action, but not therapeutic equivalence to the brand name drug. Whereas most peer-reviewed data have shown that generic drugs are as therapeutically effective as the brand name equivalents, exceptions do exist, including the thyroid hormone, bupropion, and several ophthalmic agents. Furthermore, therapeutic interchange of metformin and the TZDs, these did not produce the equivalent outcomes in patients with diabetes, according to the authors. Patients and clinicians doubt that the safety and efficacy of generics remain a barrier to increasing the use of generic drugs. National survey data show that most patients believe generics are less expensive, offer greater value to them, and should be used, but only 36% prefer the use of generics themselves. Similarly, approximately 25% of clinicians prefer not to use generics themselves or for their family. It's an interesting note. They prescribe them most frequently for their patients, but when it comes to their own personal health, they want the brand name drugs. The author suggests that by addressing these concerns will require better studies comparing the safety and efficacy of the generic versus the brand name drugs. These data are especially urgent for the widely used drug classes such as the antidepressants, the thyroid hormone, for which belief about the differences between brand name and generic drugs is strongly held by many when it comes to these two types of drugs, the antidepressants and the thyroid hormones. Difference in physical appearance of generics and their brand name counterparts might also cause confusion among patients and increase rates of non-adherence. Therefore, the American College of Physicians reports that require harmonization of the appearance of generic and brand name products. The research has found that brand name prescribing is associated with clinicians referring to drugs by the original brand name, even when the generics are available, and which is the tendency of specialists and clinicians to prescribe brand name drugs up to 78% more often than generic, with clinicians agreeing to prescribe brand name drug if the patient requests it, if the clinician receiving industry-provided food and samples or meeting with industry sales representatives and with the states do not have a mandatory generic substitution by pharmaceuticals. To counter these links, the American College of Physicians report suggests a greater regulation of interactions between drug companies and the prescribers and increasing the co-payment differentials between generic and brand name medications. You know, it goes back to the thing, if you can't afford the medication, then you really need to go to a drug that you can afford. These generics do offer a great deal of health benefits to those people suffering with especially hypertension, which is widespread. Also diabetes, which is rampant in this country at this time. The generics allow these people to adhere to protecting their health and managing their diabetes a lot better, managing their hypertension a lot better with the use of these generic drugs. And that highlights the American College of Physicians' position and study that they did on the generic versus brand name drugs. I hope you found this article interesting. I have an article here now I want to cover. We have, every 5 years we have new dietary guidelines that we are set, and so, there's advice by the United States Nutritional Guidelines released this past couple of months ago. I think it was the Department of Agriculture and Department of Health and Human Services. They're published every 5 years, as I mentioned. Diet is one of the most powerful tools, we have to control our own health, and choosing the right foods will definitely lead us on a path to good health. Health and Human Services Secretary Sylvia Burrell told reporters at a briefing that there are many ways to stay healthy, but nutrition will always be the foundation of good health. While some groups like the American Medical Association praise and support the guidelines, critics say that the recommendations don't go far enough and that they accuse the government of playing politics with Americans' health. It really is a betrayal of science to politics, says Dr. David Katz, founding director of Yale Prevention Research Center, a federally funded program that studies on how to change lifestyle and how it can prevent disease by changing these lifestyles. Public health, which seems, it affects the lives of real people, it's being thrown under the political bus many times. But some of the biggest controversies centered on what wasn't in the guidelines, the recommendation to eat less red and processed meat. The Dietary Guideline Advisory Committee, a panel of independent experts, called eating large amounts of red meat and processed meat detrimental to your health. The guidelines also recommended to eat lean meats and poultry, and it notes that eating less meat, including processed meat and processed poultry, has been linked to a lower risk of heart disease. But it doesn't offer specific instructions or limits the amount of red or processed meats. Choices can include processed meats, processed poultry, as long as eating patterns stay within the limits for sodium, saturated fats, added sugar, and calories recommended by the new guidelines as well. The science on the link between cancer and diet is very extensive. Says Dr. Richard Winder, a chief cancer control officer at the American Cancer Society. By omitting specific diet recommendations such as eating less red meat and processed meat, these guidelines miss a critical and significant opportunity to reduce suffering and death from cancer. And the Center for Science and Public Interest says that in a statement after the advisory committee made the recommendation, the scientific report was attacked by the meat industry and its allies in Congress. The National Cattlemen's Beef Association praised the guidelines, though. Lean beef is wholesome, nutrient-rich food that helps us to get back to the basics of a healthy eating pattern, providing many essential nutrients such as zinc, iron, protein, B vitamins, and fewer calories than many plant-based sources of protein. This is an issue of, is red meat harmful to you? Many studies point out that red meat is very hard to digest. It's potentially a cause of colon cancer. Of course, high uric acid. Too much red meat can elevate the uric acid levels in the body, can cause gout. Also, red meat is high in cholesterol, but there are lean cuts of beef that one can eat and would be safe for them to eat as well, staying away from the fatter portions of red meat. The guidance also recommends that we get less than 10% of our calories per day from saturated fats. These include butter, whole milk, meats that are not lean, and tropical oils such as coconut and palm oil. You know, I talked a lot about coconut oil. I cook with it myself over any other type of oil. I think it's the safest oil to cook with, more so than extra virgin olive oil. You know, they suggest that you eat no more than 2,300 milligrams of sodium. That's about 2.3 grams of sodium if you're older than 14, less of those for those younger than 14. Almost 90% of Americans eat more than the recommended daily amount of sodium. And of course, when you intake a high amount of sodium, it will give you high blood pressure and also be a cause of cardiovascular disease long-standing. You know, the guidelines do not propose restricting how much total fat we eat. However, over the past decade, researchers have shown the health benefits of eating plants, such as the Mediterranean diet, high in fruits and vegetables, but which is also high in unsaturated fats like olive oil, nuts, and fatty fish. You know, I think the olive oil gets a pass in the Mediterranean diet because of the high portion of vegetables and fruit in the diet itself. Personally speaking, the experts on vascular health have done extensive research. They say no oil at all. But coconut oil is safer to cook with over olive oil. When olive oil, extra virgin olive oil, is heated at high heat, in the olive oil, these carbon bonds are broken in the extra virgin olive oil. When these carbon bonds are broken, this causes the compound to become, you know, very dangerous. So, you know, dangerous for your health, dangerous for your vascular health as well. So, you know, coconut oil is the safest. Now they downplay the importance of consuming less dietary cholesterol, especially from eggs. And it pointed out, though, the guidelines don't recommend an unlimited quality of eggs, instead advising Americans to eat as little dietary cholesterol as possible as part of a healthy eating pattern. And you know, also for the first time, guidelines do not propose restricting how much total fat we eat. You know, I think that you just need to practice moderation in your diet and your lifestyle. I think, you know, when it comes to health, you know, you want to follow a very good diet, a very wholesome diet. Fruits and vegetables are very, very healthy for you. It can help you. It can prevent many medical issues and problems. We talked about the red meat and the potential for it causing various forms of cancer and also a rise in uric acid in the body. Go back and recap on the Zika virus. You know, it affects the pregnant woman. It's spread by mosquitoes biting these pregnant women. The mosquitoes carry the Zika virus. And, you know, the women themselves have flu-like symptoms. You know, if you know someone that's pregnant and they're having these type of symptoms, they should go to the emergency room and be checked out for this virus. Although we only have an outbreak in Texas at this time and it is controlled, they're watching this very closely because the potential, as it gets warmer and we get more mosquitoes, to see if this outbreak increases or we have further outbreaks of the Zika virus in the United States. Generic versus brand name drugs, I want to just recap and say that, you know, it's always been an issue when the elderly and those on fixed incomes go to fill a prescription. You know, can they afford the medication that will provide them with good health? And, you know, I think generic drugs and the use of generic drugs is a good alternative to allowing these people to control their diabetes, control their hypertension, and improve their health. I'm Dr. Rick Duplantis. I hope you've enjoyed this show. I hope you'll stay tuned to future episodes of the show, It's Your Health. I want to wish you a very pleasant evening, and God bless you.